Hi everyone, welcome back to MR Safety Training's YouTube channel. So on previous videos we were going through how to assess an unresponsive casualty, whether it be post-puberty or pre-puberty. So we're doing paediatric first aid there. So this time we'll go through what to do if we find a casualty, an adult casualty, who is not breathing normally or not at all. Now it's at this point, once you've assessed someone's breathing, you need to start some of the emergency services, either calling 999 or 112, and make sure we say adult, unresponsive and not breathing. Okay, and that will then tell them that they have to prioritise us more than some other casualties that they may have demand for, and therefore they need to get to us quicker. Okay, because what they're thinking is something called cardiac arrest, where the heart's gone out of rhythm. And with CPR, we are sustaining that casualty's chances until that help arrives. So it's important to summon an emergency service now at this point. So when we're talking CPR, now when I say CPR, we mean cardiopulmonary resuscitation. It's important to start off where the problem is first. Now with an adult, we're thinking cardiac arrest, where the heart goes out of rhythm, and therefore it's compressions first, chest compressions, and we do 30 of them. Okay, so importantly, the heel of the hand must go in the centre of the casualty's chest. Okay, the easiest way to find the centre of someone's chest is one finger in one armpit, other finger in the other armpit, and bring the two together. And that's where we press when we do chest compressions. However, the technical way is one finger from one hand comes from the legs and rests on the bottom of the breastbone where the ribs meet in the middle. The other finger from the other hand runs from the head end and rests on the top of the breastbone where the collarbones meet in the middle. Two thumbs equally place in the middle of the breastbone, and that's where the heel of our hand goes. Okay, other hand goes on top. We interlock the fingers, pull the bottom hand back slightly, so we're pressing down with the heel of the bottom hand on the breastbone rather than resting on the rib cage itself. If that hurts your wrist, you can turn your bottom hand in, uppermost across the top. It doesn't matter how we place our hands on the casualty's chest, as long as we're in the right place and we're pressing down with the right part of our hand. Okay. Arms nice and straight, and bring your shoulders right over the casualty's chest. So therefore, we're pressing straight down into their body. I'm pressing down 30 times at a speed of 100 to 120 beats per minute. I'm pressing down at a depth of 5 to 6 centimetres deep, so roughly about a third of their chest. Okay, so basically press down roughly 30 times. Now if you lose count, don't worry about it. Pressing down to the tune of Staying Alive. Ha, 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 staying alive, staying alive. Or, when we teach children, it tends to be wheels on the bus go round and round, round and round, round and round. Okay, so that kind of rhythm. And we press down until we can press no further. Okay, so 30 times. Now there are two ways to look at adult CPR, either if we know the casualty or if we don't know the casualty. If we do not know the casualty, or we are not trained in first aid at all, we haven't done a certificated course, then we do not do breaths. Okay? If you do not know the casualty, they might have every disease going, and our personal safety is most important, so therefore we just continue chest compressions, but we don't count to 30, we don't stop after 30, we just simply keep going till help arrives, which will hopefully be soon. If we do know the casualty, and we've been on a certificate training course, because giving breaths is actually a skill, okay, because we can very easily give breaths wrong, yeah? So if we're trained to do it, and we're happy to do it, we're sure we're going to be safe by giving mouth to mouth, then we're breathing their mouth twice. Every 30 chest compressions, we're breathing their mouth twice. So we pinch the nose, tilt the head back, so we've opened the airway, open the mouth, make sure our mouth covers their whole mouth area, and we give 2 normal breaths from us. Okay, just enough breath to watch that chest rise. When the chest stops rising, that's enough. Okay, that's enough breath. If we do want to give breaths, but we don't want to do mouth to mouth, that's fine, not a problem. Just simply close the mouth, open the nostrils, and blow up the nose twice. Okay? Which is what sometimes lifeguards do when they have a casualty in water. They do mouth to nose instead of mouth to mouth. Okay? And it's the same airway, just make sure we blow, don't suck. Okay? Good little tip. Yeah? Because we don't want any bogies in our mouth. Yeah? But it's actually most hygienic doing it mouth to nose than it is mouth to mouth. Because if anything appears at the mouth, then we will get. Okay? Because we have no barrier in between. But if anything appears in the nose, we're less likely to get because of course the natural filters that are already up there anyway. Okay? So mouth to nose is actually most hygienic. Once we're given 2 breaths, again, relocate on the chest, same way we did earlier. Arm nice and straight, back on, another 30 chest compressions, and then 2 breaths and 32, 32 until help arrives. If we're not getting the breath, we'll just simply continue chest compressions, don't stop, just keep going. But because it's quite exhausting sometimes, it is important to try and swap over with someone else every couple of minutes, because the more effective that CPR is, the more chances they've got. Okay, now remember, if you're sending someone else for an ambulance, when you check the breathing, make sure you do ask them to go and see if they can get the nearest AED, the nearest defibrillator, because that will give them, again, the better chance of recovery rather than just CPR and so on. But we'll do defibrillation in another video, so watch out for that one. So that is CPR on an adult casualty who has collapsed on the floor, become unresponsive, and they are not breathing at all, or they're not breathing normally. Thanks for watching.